Hello.
Hello.
Washing my hands. Hi, my name is Carla.
Hi.
I'll be your nurse for today. And today we'll be doing an examination from your head to your chest. The examination will probably take about 10 or 15 minutes, and we'll get that done before the doctor comes in. Is that okay?
Yes.
Okay, great. Can I see your wrist? I'm just going to verify your identity. Can you tell me your name?
Carmen Anderson.
Okay, great, Miss Anderson. And can you tell me your date of birth?
12/24/80.
Okay, great. We have Miss Anderson here today. Usually in a hospital or clinical setting, we would make sure the doors were closed, curtains pulled to ensure the patient's privacy, and the patient would be undressed with a gown on. So can you tell me, Miss Anderson, what today is?
Today's Thursday.
Okay, great. And can you tell me where you are?
I'm at the doctor's office
And what are you here for?
for an examination.
So patient is alert and oriented to person, place, time, and situation, and we'll go ahead and continue with the examination. The general overall appearance of the patient, her facial expression and mood is appropriate to the situation. Ms. Anderson, if you could just stretch your arms out for me. We're going to check the patient's skin. Okay. The patient's skin coloring is appropriate to her race. I don't see any lesions, any wounds, any signs of infection. And we're going to check the patient's skin temperature, and we do that bilaterally. Patient's skin is warm and dry. Okay, and if I can just see your fingernails. I'm going to check the patient's capillary refill. It should come back within 1 to 2 seconds, which indicates normal, and that there's no deficiency in the blood return. Check your other hand. All right, and Ms. Anderson, I'm going to go ahead and do an inspection on your head. And I'm just going to palpate your head. Tell me if you feel any pain or tenderness.
No.
Okay, great. I'm going to check the patient's hair. Make sure there's no signs of infestations or any lesions. Check the other side. All right. Okay, great. So, Miss Anderson, if you don't mind, I'm going to have you remove your glasses, and I'm going to grab my gloves. All right, so we're just going to look at the patient's face. We see that her eyebrows are symmetrical, her eyes are symmetrical and matching. We see that the face lining is symmetrical. I don't see any signs of any deformalities. And Ms. Anderson, we're just going to pull down on your eyes a little bit and check on the conjunctiva. And it's pink. The sclera is white, which is normal. I don't see any redness, any signs of any drainage. You could go ahead and put your glasses back on. And if you could just follow this pen for me. Okay. So I just checked the patient's pupils, and their pupils are equal, round, and reactive to light and accommodation. So Ms. Anderson, the next thing we're going to check is we're going to check your ears. Okay, and I'm checking the external auditory canal. I don't see any lesions on this side, any drainage. Gonna check the other side. No drainage, no lesions. Everything looks good there. And Ms. Anderson, we're gonna go ahead and check your nose. Shine this little light in your nose. Okay, no signs of inflammation, no redness, no drainage. Now we're going to check the patency of the patient's nose. Ms. Anderson, if you could just take your finger and hold your nostril. Press down and breathe in. Okay, great. And the other side for me. Breathe in. Okay, great. Everything seems normal there. We're going to go ahead and check your mouth, okay? You could go ahead and open up wide for me. Take a look at your gums. They're nice and pink. Her teeth are nice and white. And just one big ah. Stick your tongue out for me, ah. Okay, great. All right, Ms. Anderson. So the next thing we're going to do is we have everything done on your head. We're going to go ahead and move down to your chest if that's okay. Okay. So the next thing we're going to do is listen to the patient's lung sounds, and we do that with the diaphragm of the stethoscope. So I'll go ahead and make sure that's turned on. And I just need you to take some deep breaths for me, okay? In and out. And when we're checking the patient's lung sounds, we want to do that bilaterally in a Z pattern. Are you doing okay? And one more. Okay, great. Are you feeling okay? All right, we're gonna go ahead and have the patient stand up so we can check the posterior of her lungs. You can just turn around and face that way for me. This is fine right here. We're gonna start at the APCs. Go ahead. In and out. You feeling okay?
Yes.
And when we do the posterior of the chest, we also do that bilaterally in a Z pattern. Checking to make sure that we don't hear any abnormal breathing. One more. And one more. All right, and Miss Anderson, if you just turn this way for me, while I have you standing, I'm going to go ahead and check your upper and lower lobes of your lung. So I'm going to start on the right side and check the right upper lobe. Just take a deep breath in and out for me. Great. And we're going to check the left upper lobe. Okay, great. And the left upper lobe. So the reason why we check the left upper lobe twice, Miss Anderson, is because your left lungs only have 2 lobes, and your right lobe, your right lung has 3. And one more. All right, Miss Anderson, you can go ahead and have a seat. Sorry to make you get up and down like this. Okay. So the next thing we're going to do is we're just going to do a comparison of the patient's chest, her anterior, posterior, and everything looks normal. The patient doesn't seem to have any trouble breathing or be in any type of distress. So the next thing we're going to do is check the patient's carotid pulses. If you lift your head just a little bit, we're going to check the left side, and we're going to do them one at a time, bilaterally. And we're checking the bounding pulses of the patient, and hers is 2+, which indicates normal. Miss Anderson, last time, I need you to go ahead and climb up on the bed for me.
Okay.
The next thing we're going to do is check the patient's JVD, her jugular vein distension, and we're going to check to make sure there's no signs of heart failure in the patient. So just lay back for me, and if you don't mind, look this way towards me. Okay, her JVD is nice and flat. I don't see any bulging. And just turn your head. We're going to check the other side. And again, as you see, her JVD is nice and flat. No signs of bulging. All right, Miss Anderson. Go ahead and sit up for me. And you can stay right there. The last thing we're going to do is just check your heart. We start checking the heart with the diaphragm of the stethoscope, starting at the aortic, located at the second intercostal left sternum. Check the pulmonic, second intercostal left sternum. Excuse me, the first one was aortic, second intercostal right sternum. Then we're going to check the Erb's point, which is third intercostal left sternum. And then we're going to check fifth intercostal space, left sternum. And the last thing is mitral valve. There you go. Okay, good. I didn't hear any abnormal heartbeats or any murmurs. I'm going to go ahead and do an inspection with the bell of my stethoscope, which indicates low pitch sounds of the patient's heart. So we're going to start at the aortic, second intercostal, right sternal, pulmonic, okay, and the Erb's point, fifth intercostal, left sternum, and last, mitral, fifth intercostal, mid clavicular line. All right, Miss Anderson, how are you feeling?
Okay.
All right, tell me, are you having any pain?
No.
Okay, and is there anything else I can do for you before the doctor comes in to see you?
No, ma'am.
All right, Miss Anderson, well, thank you for being patient. It was a pleasure to meet you, and you have a good day.
You too.
Thank you. Washing my hands.